Most people over 55 try to deal with lower back pain after 50 in the hardest way possible. They turn to aggressive stretching, expensive devices, or they stop moving altogether, unfortunately. That's usually the opposite of what the back truly needs. Today, I'm going to show you a gentle, natural 10-minute routine that actually works by addressing the stiffness and core weakness that develop with age. This type of pain is often the result of years of poor posture, limited movement, and a natural decline in muscle mass. We're not just covering up symptoms, we're working directly on the root cause using safe, effective movements. It's time to stop fearing movement and start using it correctly. This isn't random advice or guesswork. Everything you'll see comes from years of physiotherapy research and real-world clinical experience, specifically focused on adults over 55. We've taken the most effective techniques and simplified them into a routine you can safely do at home using only a chair and a towel. No gym required. In the next 10 minutes, we'll go through 3 essential pain-relieving movements that form the foundation of a healthy back. After that, we'll cover 2 surprising food fixes that help calm inflammation from the inside. And finally, I'll explain one major mistake that almost everyone makes that quietly blocks healing. Please stay for move number 3. It's the one many patients say brings relief the fastest and is often missed. Before we begin, remember this important rule: all movements should be gentle and controlled. Never push into sharp, shooting, or radiating pain. If you feel that, stop immediately and speak with your doctor. We're aiming for a mild, comfortable stretch. Move 1. Pelvic tilts. This is the gentle wake-up call for your spine. Pelvic tilts retrain your lower back and core to work together again. A loss of this coordination is one of the main causes of back pain after 50. Safety setup: lie on your back on a mat or rug with your knees bent and feet flat on the floor. If getting down is difficult, sit upright in a firm chair with your feet flat and hip-width apart. Now imagine your pelvis as a bowl of water. Slowly tilt the bowl toward your head so your lower back gently presses into the floor or chair. Hold for 5 seconds. Then tilt the bowl away, creating a small arch in your lower back. That's 1 repetition. We'll do 10 slow reps. 5 seconds to tilt, 5 seconds to hold, 5 seconds to release. About 2.5 minutes total. Breathe normally. Inhale as you release. Exhale as you flatten the back. Keep the movement small. These tiny, controlled motions create the biggest long-term improvement. This works because the deep core muscles act like a natural support belt for your spine. Over time, we lose the ability to activate them properly. Pelvic tilts restore that connection. This is an endurance exercise, not a strength one. The movement should be subtle. Avoid tightening your glutes or large abdominal muscles. Think of it as small movement for big relief. This step prepares your spine to handle daily load safely and helps prevent future injury. Move 2. Knee to chest stretch. This classic stretch gently decompresses the spine and improves circulation to the discs, which can stiffen and dry out with age. Lie on your back and keep one leg bent or extended, whatever feels more comfortable. Slowly bring one knee toward your chest. Hold behind the thigh or shin, not the kneecap. Pull only until you feel a gentle stretch in the lower back or buttock. Hold for 30 seconds. Then switch sides. Chair option. Sit tall and cross one ankle over the opposite knee. Lean forward slightly from the hips until you feel a stretch in the hip and glute. Hold for 30 seconds per side. This stretch is especially helpful for sciatica-type discomfort because it releases tight hip muscles that place stress on the lower back. Keep your shoulders relaxed. You should feel the stretch in the hip or glute, not the knee. If the knee feels uncomfortable, ease off immediately. As we age, long periods of sitting cause hip flexors to tighten, pulling the pelvis forward and increasing pressure on the lower spine. By gently stretching these areas, we reduce mechanical stress on the back. This isn't just about comfort, it's about correcting posture and alignment. Move 3. Prone press-ups. McKenzie method. This is the movement many people find brings the fastest rally. However, if this increases leg pain or causes pain to travel further down the leg, stop immediately. Lie on your stomach and rest on your elbows like you're reading. Stay here for 1 minute if comfortable. If ready, place your hands under your shoulders and slowly press your upper body up while keeping your hips relaxed on the floor. Hold for 1 to 2 seconds, then lower down. Do 10 gentle repetitions. Chair option. Stand, place your hands on your lower back, and gently lean backward a few inches. Repeat 10 times. This movement encourages the spine to move into extension, helping relieve pressure on irritated nerves caused by prolonged sitting. If pain moves upward toward the lower back or simply decreases, that's a good sign. If pain moves further down the leg, stop and consult a professional. Always move gently and never force the range. You've now completed the 3 most important movements for lower back health. Doing just these daily can make a significant difference. Now let's support healing from the inside. Food fix 1. Omega-3 fatty acids. Lower back pain often involves inflammation. Omega-3 South, found in fatty fish like salmon and sardines or in quality supplements, help reduce inflammation naturally. Aim to eat fatty fish twice a week or choose a supplement with at least 1,000 milligrams of combined EPA and DHA. Food fix 2. Magnesium. Magnesium supports muscle relaxation and nerve function. Low levels can lead to tightness, cramping, and persistent back discomfort. Foods like leafy greens, pumpkin seeds, almonds, and avocados are good sources. Many adults over 50 benefit from magnesium glycinate supplements, especially taken in the evening to support relaxation and sleep. Magnesium also supports bone health and nerve signaling. Modern diets are often low in this mineral, and deficiency can contribute to ongoing muscle tension. The one mistake to avoid: complete rest. When pain appears, many people stop moving completely. This is one of the biggest mistakes for chronic back pain. Movement is nourishment for your spine. Too much rest leads to stiffness, weakness, and increased pain sensitivity. Gentle, regular movement is what promotes healing. If pain is severe, short rest is okay, but only for a day or 2. After that, start gentle movement again. Small steps matter. Fear of movement actually makes pain worse over time. This routine is designed to rebuild trust in movement and show your body that it's safe to move again. Quick recap: pelvic tilts, 10 reps knee to chest stretch, 30 seconds per side prone press-ups, 10 reps nutrition. Omega-3 South and magnesium avoid, complete. Immobility. You don't need an hour. You need 10 focused minutes. Commit to this routine and take control of your back health. If this helped you, like the video, subscribe for more evidence-based senior health content. And tell us in the comments which movement helped you most today.